Now, before we dive into today's video, do not forget to subscribe to my YouTube channel to stay up to date with our videos and free resources. And please remember that you can access our review courses, quizzes, and flashcards by going to nursingcram.com.
In this video, we are going to go over serotonin discontinuation syndrome. We'll cover what happens when someone stops taking their antidepressant, which medications are more likely to cause this condition, the signs and symptoms, how it's diagnosed, and how it's treated. First, we are going to go over which medications are more likely to cause serotonin discontinuation syndrome. Almost all antidepressants can lead to this condition, but some are more likely to do so. Among SSRIs, paroxetine has the highest risk, followed by fluvoxamine. Meanwhile, fluoxetine has the lowest risk because of its long half-life, which allows for a natural taper. Other types of antidepressants that can cause serotonin discontinuation syndrome include TCAs, MAOI, and SNRIs. For example, duloxetine and venlafaxine. Venlafaxine, Effexor, has one of the shortest half-lives, which increases the risk of discontinuation syndrome if it's stopped abruptly. One of the best ways to prevent discontinuation syndrome is to taper the medication slowly. If a patient stops or reduces their antidepressant too quickly, symptoms typically begin within 2 to 4 days. However, they can start as early as 24 hours. The way I remember the signs and symptoms is by using the mnemonic finish. So when you finish your antidepressants, you might see F for flu-like symptoms, for example, fatigue, lethargy, or myalgia, which is muscle soreness and achiness. I for insomnia. N for nausea and vomiting. The second I is for imbalance. You might see dizziness and vertigo. You might also see ataxia, which is impaired balance or coordination. The S is for sensory and memory disturbance. You might see decreased concentration, impaired memory, and paresthesia, including shock-like sensations. And lastly, H is for hyperarousal. You might see agitation, anxiety, or irritability. What factors can increase the risk of discontinuation syndrome? The risks include sudden discontinuation of medication. Short half-life medications, for example, the two medications we brought up earlier, paroxetine and venlafaxine. Inconsistent or irregular medication use. So if the patient is non-compliant or not taking medication as directed, it will increase the risk. Long-term use and previous history of discontinuation syndrome. So if the patient has had discontinuation syndrome in the past, they are at higher risk of getting it again. A diagnosis can be made if a patient has recently stopped or rapidly reduced an antidepressant and they are presenting with the symptoms we discussed. The best treatment is to restart the antidepressant at the previous dose. Symptoms usually resolve within 1 to 3 days, with most patients improving within 24 to 48 hours. Once symptoms are under control, a slower, gradual tapering schedule should be followed if discontinuation of the medication is still the goal.
Thank you for watching this video, and remember that you can access our resources, review courses, quizzes, and flashcards by going to nursingcram.com. And don't forget to like and subscribe.